You're a resident, so you don't have to be here.
I do feel an obligation kind of in my profession to serve in this pandemic. It is hard.
For almost 18 months, medical residents like Dr. Courtney Welch have been standing side by side teams in hospitals fighting COVID-19. This is the start of Dr. Welch's career, and she hopes this will be the hardest time she will ever go through professionally. Dr. Welch works at IU Health Methodist Hospital. As of lunchtime today, IU Health is treating 81 COVID patients between Methodist and University hospitals in Indianapolis. That's a major increase from last Friday when there were 57 patients between both hospitals, and doctors say they expect the number to increase even more. Tonight, our Nikki DeMentri shares the perspective of Dr. Welch and what she hopes you will learn through her story.
Courtney Welch is an adopted Hoosier. She calls herself a plant mom who loves to hike, especially at Eagle Creek. The Texas native also identifies strongly with her faith.
I feel like sometimes just saying a prayer, to have that motivation that's from outside of me.
It's something she's relied heavily on during the pandemic.
It might be my everyday, but it's someone else's worst day of their life.
Her everyday is spent part of the time here in a Methodist hospital COVID unit.
In the front lines, it's hard to see people still suffering.
Dr. Welch is a third-year internal medicine and pediatrics resident. Fighting a pandemic on the front lines was certainly not on the syllabus.
I think that was really motivating at the beginning of the pandemic to see that togetherness and just that people would come out and clap in hospital parking lots for people who were fighting the good fight.
But the waning community support over the last few months hurts.
That feeling of us all being together on the same team, I miss it. I long for it a little bit.
Welch says it's becoming tiring talking into the noise.
We're all saying, please get vaccinated, and then people that are resistant to that still want medical care, and we're happy to give that to them here. We still want to fight the fight with you. We want your help.
With the Delta variant, she's seeing young Hoosiers with no underlying conditions and pregnant women in the COVID unit.
How I stay motivated is knowing that I have patients who weren't vaccinated. They're telling me they're calling their family members and saying, run to your CVS, run to your hospital, run to your doctor to get the vaccine.
And preventative care is the single most important thing Welch feels she can do right now.
As a community, we have to think about each other and how we're best taking care of each other.
Okay, thanks so much.
In Indianapolis, Nikki DeMentri, WRTV.
Doctors keep saying this: the best way to protect yourself from COVID-19 and ease the burden on hospitals is to get vaccinated. To be completely transparent, it's still possible to get COVID even if you are fully vaccinated. In fact, the Indiana Department of Health reports more than 9,900 breakthrough cases. A breakthrough case is any person who tests positive for COVID at least 14 days after their final vaccine dose. But that's still less than 1% of all fully vaccinated individuals. And there have only been 272 breakthrough hospitalizations and 83 breakthrough deaths. Both of those numbers are far less than 1% of fully vaccinated Hoosiers. And the average age of those breakthrough deaths is 80 years old. So for the most part, vaccines are working to keep people alive and out of hospitals. And despite the effectiveness of the vaccine, just 51.8% of eligible Hoosiers are fully vaccinated. However, there has been an increase in people getting the first dose of the vaccine, leading to hope they return for their second shot and become fully vaccinated. Over the past 24 hours, more than 6,600 people in Indiana got their first COVID shot. 5,800 others became fully vaccinated over the same time frame. So it's easy to sign up for a shot. Just go to the website ourshot.in.gov or dial 211. Many clinics also accept walk-ins.